YWCA Northeast Tennessee and Southwest Virginia, along with YW Cares, proudly presents It Takes a Village, a podcast highlighting the importance and need for victim advocacy services throughout our region. Join us as we detail the real-world issues of human trafficking that, unfortunately, are prevalent within our region. We are honored to be able to speak with other organizations that are doing their part to fight against human trafficking and learn more about the steps they are taking in order to not only advocate for current victims, but also prevent future victims. I'm Heather Smith, and thank you for joining us today. Today, I have the opportunity to sit down with Ms. Raina Zakaria, community educator of the Community Coalition Against Human Trafficking. The CCAHT is the only counter-trafficking organization in East Tennessee that unites and equips our community to end human trafficking while providing survivors with comprehensive, trauma-informed aftercare services. Raina joins us today to provide education on the red flags to identify human trafficking. We are so honored to have the chance to sit down with you today.
Thank you so much, Heather. I'm really glad to be here.
Would you care to kind of speak a little bit about the specific programs and services that the CCAHT offers to help kind of fulfill that mission?
Sure. So our first thing is that we do trainings. We have 13 free community focused and professional curriculum that we offer for our primary responders, our industry professionals, and community members that just want to learn more about it, how to recognize those red flags and how to safely respond to trafficking. We also have our task force. We have two, one in the Knox County area and the other one in the Tri-Cities area, Free Knox Kids and 423 Unsilence, which we bring service providers together with community agencies discussing challenging cases that's happening with our minors, how they're falling in between the gaps and cracks of the systems and ensuring that these victims have the proper resources and services. We also provide survivor services for our adults that identify as female. We have two safe houses. But through our direct service program, Grow Free, we provide these individuals with a wide variety of trauma-informed services that provide them pathways for safety and recovering, just loving on them. And last, we have our safe houses. We have a short-term safe house and we have a transitional safe house that's fairly new, but this provides 24-hour support in any way that they need, case management, food, clothing, rides to their doctor's offices, to court dates, access to medical care, safety planning. So we have 4 case management, or we call them care coordinators, that work with these survivors within the shelter and also within the community. So we collaborate with lots of folks in East Tennessee to coordinate this comprehensive care for these individuals.
It's amazing to hear about just the vast array of programs that you hear the CCAHT, implements there. And I love the concept of, you kind of have the capacity to not only just get them out of that situation, but also help them long term, which I think is so incredibly important. And you had mentioned, educating about red flags, and that's actually what we're here today to speak about. So when you use the phrase red flag, at its core, what does that term mean? And how exactly does defining that term or that phrase help to identify possible cases of human trafficking?
Right. So when we use the term red flags, we're talking about an indicator of something potentially dangerous happening or occurring. Does a red flag necessarily mean that this person is being trafficked? Not necessarily, but it means this person might not be in a safe situation, that this person is vulnerable and needs assistance. So each red flag taken individually may not imply that this person, again, is being trafficked. However, recognizing several of these red flags or indicators may point to the fact that this person needs a referral or a further assessment. So when we do our trainings with our direct service folks who are on the front line interacting with these populations, we want to make sure that they're asking the right questions, looking for those indicators and assessing what steps are needed next to ensure this individual is assisted in any way that they need.
Thank you so much for kind of breaking that term down. I feel as though getting a better understanding of that exact definition of that phrase, red flag, specifically when it comes to identifying potential cases of human trafficking, it can really just help others better understand once we get into those specific red flags. So once again, thank you for taking the time to break that down. So now with this definition in mind, can you kind of speak about those specific red flags that might possibly indicate a case of human trafficking?
Sure. So things that we want to be on the lookout for is, if this person has become socially isolated, let's say they're traffickers, their partner, for example. And one thing I want to say is that lots of times we see that these individuals have similar red flags as someone that's in a domestic violence relationship. And there is indeed that intersectionality of domestic violence and trafficking. But we've seen like evidence of controlling or dominating relationship. Of course, signs of physical or sexual abuse. Maybe this person is fearful of authority figures. Traffickers use that force, fraud, and coercion and convince this individual that law enforcement, social workers are not on their side. And they become very defensive and aggressive. These are the most resilient people you'll ever meet. That being said, they might be aggressive or defensive or might not want assistance, might not identify that they're being trafficked. But other indicators or red flags that we see, maybe this person is malnourished. They might be dressed for the summertime and it's winter time and they've maybe worn that outfit for a long time. No personal belongings, no identification on them. Traffickers lots of times withhold that to prevent them from trying to get assistance from other agencies. Maybe this person has been moving frequently from one place to another under the influence of drugs. And I always tell folks, go with your gut feeling. If something is not making sense when you're interacting with this person, always try to have a natural conversation with this person. We don't want to go about it in an interrogative way, but you can say, I'm really worried about you. I've noticed these kind of things. Are you okay? Do you feel safe? Can I help you in any way?
I think I speak for probably a lot of people when I say that a lot of times, we can be very privileged in the sense that these might be things we have never had to deal with firsthand. And because of this, these could very well be things we might overlook. One thing I'm very interested in learning more about is keeping in mind these red flags. Are there specific red flags that you see more prevalent in cases of human trafficking in this particular region?
So it all goes back to vulnerabilities because traffickers exploit someone by their vulnerabilities. And what we see most often here in East Tennessee, biggest vulnerability is poverty, right? Poverty creates despair and traffickers target these poor and marginalized communities and populations to offer this person some sort of false opportunity to improve their circumstances. And that person that's in a pickle is more likely to take that risk to improve their circumstances. Another thing that we see, another vulnerability that we see here is in East Tennessee is addiction, so substance abuse. And traffickers use that substance abuse to control that individual. They will sometimes purposely supply that drug to break down their resistance and to coerce them into that forced labor or that sex. And of course, once that person becomes dependent on that substance, that trafficker now has the perfect blackmail to keep that person in that cycle. And lastly, mental health. That's something that we lately, now I'm glad we're talking about it more often, is people with mental health issues are going to face a variety of challenges, including isolation, not understanding if someone has ill intentions and wants to harm them, not getting the vibe if someone has, that bad irky, I'm gonna manipulate you kind of thing. So unfortunately, traffickers are very skilled at detecting these vulnerabilities and manipulating them to their advantage.
It's that word vulnerable. It's something that you use very often there just then. And it's essentially they're preying on people's at the time weaknesses, their darker times, and using that for their advantage. And it's really incredibly eye-opening to see that there can be different aspects that is kind of catered specifically to different areas based on kind of like the population there. And you've kind of gone into this a little bit, but I'd like to shift here for a moment and kind of, as you were speaking about before, take a look at the side of risk factors, those vulnerabilities, again, of people of all ages. Are there any others that you can think of that might make people more susceptible to becoming victims?
Absolutely. Yeah. So maybe a previous history of physical or sexual abuse. You know, we've seen with our minors that if there's a current or past involvement being in the child welfare system, puts them more at risk. And kids are born to be dependent on somebody. So when they don't have that in their lives, they go looking for it. And traffickers know that these kids want to be loved and needed, and that sometimes it can be a very vicious cycle going from one home to a foster home. And a scary statistic is that within 48 hours, 1 out of 3 kids that run away will be approached by a trafficker. So they know that these kids are extremely vulnerable. Anyone with a lack of social support, someone that has a high ACE score, family dysfunction or instability, poor self-esteem, our LGBTQ, community or population, especially here in the South, lots of times are shunned. So any marginalized population that we see here in East Tennessee is extremely at risk for being trafficked. That's why it's so important for us to find upstream solutions when it comes to this. Coming from my background, I'm a public health person. I looked at it as it definitely is a public health issue. And as long as we have vulnerable populations, traffickers will always find someone to exploit. And some folks may never come into contact with someone who's being trafficked, but every single one of us knows somebody who's vulnerable. And there are so many ways that we can find upstream solutions to this. You don't have to volunteer or donate to our agency, but what are some ways that you can give back to your community, working with the homeless population, our LGBTQ kids, whatever it is? I can't emphasize the phrase knowledge is power when it comes to the work that we do in our initiative. We have to recognize that the social and economic determinants of health may lead to this. And not only should we be looking at this from the criminal justice or social service response, but also incorporate as much preventative strategies we have or we can for each county, because each county might have more vulnerabilities than the other one. So it's going to take a team. It's going to take a community to eradicate this.
It definitely takes a village. Absolutely. And I love that the whole education is key. It is. And I think a lot that we can do is to put, the education out there, like we're talking about today, the red flags. These might be things that people of the community have never even thought of. You've provided such a good array of education just in this little short episode that we're doing here. And, I think today the question I would like to end on is about what to do in a situation that you might be suspicious or worried that it could very well be a case of human trafficking. What are those first steps that a person needs to take if they have concerns?
Absolutely. So before all of that, if you see something, take our trainings. They are great, funded, they're free. We can do them in person or via Zoom. Educate yourself beforehand. I always say, in the moment, you might be paralyzed and not, freak out and think, oh my gosh, what do I do? I don't want to traumatize this person. So take one of our trainings. It's full of resources. We just want to make sure that everyone feels more comfortable and equipped when it comes to this topic. But numbers that we want you to call, you can call the Tennessee Human Trafficking Hotline. You can call our hotline, and I can give these numbers to you after this. But we want to make sure that your safety and that individual safety is the number one concern. So as much as we want to go in and say, hey, I'm going to save you, let's be careful because we don't know the circumstances. That individual is stuck in that cycle for many reasons, and it could be where this trafficker has physically assaulted this person. So we don't want to endanger anyone's life, but we want you to call local law enforcement. We want you to call, TBI, the hotline, and we want you to ask questions while you're giving this information. You can say, hey, I suspect trafficking. What else do I need to do? If it's a minor, we know that kids or minors cannot consent to sex. So we don't have to have proof of force, fraud, or coercion. You immediately call local law enforcement and DCS. Either one of those agencies will give you a referral number. Write that referral number down and ask them, what else do I need to do? What else do I need to know? And make sure that you follow up if something has not been addressed within the right amount of time. Call back and give that referral number and say, hey, what's up? What's the status? Updating what's going on. So those are the first steps I would recommend.
Thank you so much. And I think it's super, once again, eye-opening to just have a better understanding that you want to be the hero so bad. Like you said, you want to save them then and there in that moment. But being able to have a better understanding about, well, you also don't want to put yourself in danger or further endanger the potential victim in this situation. So knowing there's specific ways to go about doing that while keeping everybody's safety in mind is something that's amazing to hear. Rena, I want to thank you so much for just all of your knowledge and it's been so eye-opening to hear, you speak, and you speak from such a place of passion. It beams, you can tell your heart is there. You've most definitely educated myself, and I'm sure others as well. And your work within the community to help shed light on these victims of human trafficking, as well as to educate about the signs to look for, like I said, it takes such a passionate heart to do. And I want to thank you for taking the time to sit down and speak with me today and open my eyes, as well as I'm sure the eyes of others on this topic that is very prevalent in our region. Thank you so much.
Thank you again for giving the time and the platform to talk about this really important subject. And I hope folks feel comfortable after hearing our little talk to reach out to us, to be advocates in the community, and help, start this ripple wave effect to end human trafficking.
Thank you.
To report any suspicion of human trafficking, you can contact the Tennessee Human Trafficking Hotline at 1-855-55-TNHTH, the National Human Trafficking Hotline at 1-888-373-7888, or text HELP or INFO to 233-733. You can also contact your local law enforcement office or report online at the link provided. For training and webinars hosted by CCAHT, visit the link below. Thank you.